Coming up on primary care, more than 75% of the Black community is considered overweight or obese, making this a crisis for this community.
But when it comes to obesity, unfortunately, there is a lot of stigma and bias where people make a lot of assumptions about people about their weight, and there are still hormonal and genetic factors that play a role.
Hello and welcome to Primary Care, the show dedicated to improving the health of African Americans. I'm your host, Dr. Lonnie Joe. Obesity has become a public health crisis in this country to where more than 4 in 10 adults, about 100 million people, are obese. People living with obesity are more than likely to develop a number of serious medical conditions. We also know that obesity disproportionately affects Black and Hispanic Americans. According to the Office of Minority Health, 75% of the Black community is affected by obesity, and 80% of Black women are either overweight or obese. Given this crisis, here to tell us what's needed to better understand obesity and its effect on our health is Dr. Dafina Allen. Dr. Allen is a double-boarded certified family medicine and obesity medicine physician with her own practice, Wise Weight Management. Doctor, welcome to the show.
Thank you so much for having me.
Great. You know, the new technology using the EMR system, automatically calculating this thing called BMI, and patients seeing it on their papers walking out of the office say, what do you mean I'm obese? It's gone from overweight to obesity only because they are not losing weight. So what is obesity?
So obesity is actually when your body mass index, or your BMI, it's calculated basically just off of your height and your weight. And so when your BMI is 30 or higher, then that's when we would categorize it as obesity.
So patients need to get used to the term.
Yes, and it's actually a very complicated condition. So the BMI is a screening tool. So basically, using our height and weight, we're able to understand what someone's BMI is. However, it's just a screening tool because you could actually have an elevated BMI and not have obesity if you have a high muscle mass. So it is complicated, but it is important to understand what your BMI is and be able to talk to your doctor about it.
Right, and for years the BMI has been suspect, especially in certain populations like Asians, and being considered to be underweight with the body structure that they have. So the BMI, like you say, is a screening tool, but something that we should strictly be paying attention to, especially if it's not coming down.
Absolutely, yes. And I always like to think about it as it's a way to look into your health and take a closer look. So other factors that can also contribute, put together the picture of obesity, would be an increased waist circumference. So if your inches are increased around your waist, that plays a role. And then also your body fat percentage and your fat mass percentage, those are other factors that can play a role to contribute to the disease of obesity.
So being overweight can affect particular parts of the body. We have patients who, they wear out their knees simply because they've been obese for so many years in a row without any real effort to lose weight. What kind of issues are we faced with in terms of people that are obese and particular areas of the body that are affected?
So many parts of the body.
A lot.
Absolutely. Obesity can affect almost every part of our body, like you were already mentioning osteoarthritis. So arthritis in our knees and our back, our joints, because of the extra pressure that's being put on our joints when you're carrying extra fat, as well as your heart. So increased fat mass can actually strain the heart. Increased fat around the heart can also contribute to heart disease and increase that risk, as well as even our liver. So fatty liver, when there's increased fat in our body, fatty liver can also even contribute to liver disease. So those are only a few, but just a few.
Right, and can affect life expectancy.
Absolutely. Mm-hmm.
So basically, this patient should be looking at this no matter how old they are. By the way, we will touch on childhood obesity, which is another issue in this country, but no matter how old they are, they should be looking at trying to correct this disease state called obesity so that they can actually improve not only the quality of life, but life expectancy also.
Absolutely. And actually, having a BMI of 40 or higher is associated with the reduced life expectancies. Now, there's not an exact amount where we can say, if your BMI is this number, you have this less many years to live. But just because if your BMI is 40 or higher and you have significant obesity, then your rates of type 2 diabetes are so much higher, as well as rates of heart disease and as well as strokes as well, much, much higher. So it's actually surpass smoking as like one of the preventable causes of death. And I'm saying preventable because there are ways that we can prevent it. There's also genetic factors that play a role as well with obesity.
So risk factors change a little bit in definition. If you're obese, it's harder to exercise, so you probably get less exercise. If you're obese, you're probably leaning toward a sleep issue or a sleep apnea picture that significantly overweight people develop, or stress just from being obese. People tend not to look at that, but it's a major factor. So being obese is beginning to produce a lot of issues for us that basically not only will shorten your life, but will make you miserable in the time span that you'll live.
You're absolutely right. And there's so much weight stigma and bias. So obesity is a chronic disease, and more medical organizations are now, respecting that and starting to highlight the fact that if someone has high blood pressure and you are taking medication and seeing your doctor for high blood pressure, people are not going to look at you and say, oh, you're lazy and oh, that's a crutch. But when it comes to obesity, unfortunately, there is a lot of stigma and bias where people make a lot of assumptions about people about their weight. And there are still hormonal and genetic factors that play a role.
So all things taken into consideration here, why are black women more obese than black men?
That's a really great question. And I mean, even blacks as a whole, we are already more affected by obesity than, all the other cultures. Black women in particular, it's also another complicated situation because it's societal, it's social, it's cultural. A lot of Black women also are affected with higher rates of depression, which can go along with obesity. A lot of Black women are less active, and so that also can contribute to obesity, and not because of laziness, but just because of time factors and the other demands on their time. And unfortunately, there's a big group of Black men that we don't have enough data on because of incarceration rates, where actually we are finding that the rates for Black men of obesity, it's not as high as Black women, but it's still pretty high. And sometimes we don't get enough data from them because a lot of Black men, unfortunately, don't go to the doctor.
Right.
So that plays a role. And also, Black women actually do have higher amounts of muscle mass, but we're not able to detect that with just the BMI. And so sometimes Black women are said to have obesity, and actually they really have higher amounts of muscle mass that contributes to their overall weight as well.
So since we're talking about Black females here, are there any particular disease states or development of disease states in Black women that have a real link to being obese, like polycystic ovarian disease or fibroid tumors?
Very good question, and so true that polycystic ovarian syndrome as well as fibroids are actually higher rates for Black women. So, and it goes hand in hand. I mean, more Black women are affected with PCOS, and so a lot of Black women have higher testosterone levels, and it's more affecting more infertility, but it also has to do with their insulin levels. PCOS, polycystic ovarian syndrome, also does affect your insulin levels, which can increase your risk of obesity. And fibroids as well. A lot of Black women do have fibroids, making it harder to exercise because of heavier periods and more cramping and more challenges with the way that they're able to move. And so with those challenges, that is another reason why there are higher rates of obesity in Black women.
So how should primary care physicians be put into the mix here in the conversation? How should they be communicating with patients about this disease?
That's such a great question because it is so important for primary care physicians. We are on the front lines, right? And so we want to approach all of our patients with respect, and also we want to take care of our patients' health. I've talked to so many primary care physicians that said, I don't know how to talk to my patients about obesity. I don't want them to be offended. So the first way that I always recommend is by saying, can I have a conversation with you about how your health is affected by your weight? And so just by opening up that conversation about the only reason we're talking about your weight is because of your health, talking about it in that way and helping patients to understand it's not all their fault. A lot of patients feel attacked and they're ready for them to be called lazy and that they're inactive, and a lot of patients are trying.
Yeah. We're judgmental too much in this particular disease state and others also.
Absolutely.
How do we get patients to buy into this? How do we get them to understand that they have a responsibility as well in treating obesity?
Good question. So a big part of obesity medicine is motivational interviewing. And so empowering our patients to understand that although there are the hormonal and the genetic parts that are not in their control, they do have control over what they're eating to a certain extent, and they do have control over how active they are. And so my goal with my patients, and as well as when I'm talking to others about obesity, is to help patients understand that even with the busy lifestyle, even if there is income challenges, you can still lose weight.
That motivational interview or motivational discussion has to exist outside of just what we're doing there in terms of the traditional doctor-patient relationship. It has to extend itself in order to say, listen, we need to talk about these other things also, that few we've touched on here. Dr. Allen, is there a risk in normalizing obesity from a standpoint of view of outcomes?
Good question. So the great news is that you can be healthy at any size.
And be overweight.
You can absolutely be overweight and be healthy. I have some patients I work with, we start working together, and their BMI is 50. They might weigh 400 pounds. We work together for a year, and I give them a comprehensive plan. They might lose 100 pounds. Now they weigh 300 pounds, they still have obesity, but their blood sugar is improved. They're active, they've lost inches, and they've improved muscle mass. That is healthy for that patient, even though their BMI might still say obesity. So it is okay as long as we understand that it's going to be different for every patient in terms of their health.
So we should not get drawn into or go down that road too much that talks about the way that you look or your dress size or the shaming that comes with being overweight or being obese. That's a real problem in some instances because people are not realistic about what the weight goal should be.
You are so correct. Actually, that is honestly one of the bigger challenges in my field are the patients that patients wanting me to help them be thin. And I'm like, hey, I'm a doctor. I'm in this for your health like any other doctor. But because of society, the pressures on being a certain size, and even right now with these new weight loss medications, which I'm so excited to talk about, a lot of celebrities are, taking these medications to make them even thinner, that it's really not indicated for that reason. And so we do have to be very careful. And my job is to support my patients. And actually losing 5% of your weight actually lowers your health risk, lowers your risk of diabetes, strokes, and heart attacks. So I always explain that to patients, and I try to get them away from a goal for a number goal, because there's no evidence that is important in terms of your weight loss journey.
So we invest a lot of money in the way that we look, our hair, our makeup, our everything, and trying to be realistic about weight becomes pretty much a problem if we're not careful. How do we better educate people about their bodies in general?
So honestly, continuing to encourage patients that their health is what matters versus their size. And yes, you will feel better when you lose weight, but staying focused on non-scale related victories.
Okay.
That's my big
like
passion.
That.
Yes. So yeah, and you'll hear a lot of different obesity medicine specialists talking about this, because when your clothes fit better, yes, you feel more confident. But when you can run around with your grandkids That's what
even better.
matters more,
Yeah.
right? When you're taking 3 blood pressure medicines instead of 5, that matters more, right? And when you are noticing that your blood sugars are improving and your complications related to your diabetes are going down,
Right.
that is what matters so much more than that number we're looking at on the scale.
Right. For years, we've been looking at eliminating protein in the urine based on the disease state. Obesity is part of that factor, part of the diabetic and the hypertensive patient who has lost the weight, maintained the medication, in some instances reducing the medication like you mentioned, and eliminating the protein in the urine, even with normal renal function otherwise. I mean, it's an amazing system that the body has of looking at this. Let's turn to treatment options for a minute. Why don't we start with surgery?
Sure. So bariatric surgery can be a very important part of some patients' journeys with obesity. So if your BMI is 40 or higher, just so we're all aware, your insurance will cover bariatric surgery. Or if your BMI is 30 or 35 or higher with a medical condition such as diabetes or cholesterol or sleep apnea. So those are the indications for bariatric surgery. Now, 3 to 5% of patients that are bariatric surgery candidates actually get the surgery because of the fact that there's so much information out there that patients are afraid of. They're thinking about the complications, which of course, surgery does have its risk, but it can be a really great part of a comprehensive plan for your obesity if you have the tools and are taught how to keep it off. I see a lot of patients that come back to me after they've had bariatric surgery that have regained their weight because they weren't given the tools of how to keep it off.
Speaking of the medication, we are in a news blitz about this that is prolonged. Everybody knows the various brand names for the most part, and the new ones that are coming on board are gaining steam also. What's the role of using those types of injectable medications mostly once a week in the treatment of obesity?
So you are so right. You cannot watch the news. You cannot go on social media. You can't sit on the bus, anything without hearing about these medications. It's a really exciting time in the field of obesity medication because actually these are really great medicines that can be used for some. And when I say that, they work very well for many patients. They are indicated if you have a BMI of 30 or higher or 27 or higher with a medical condition. Now, I'm saying some though, because we do have patients that cannot tolerate this medicine. And it's just not the right fit for them, just like any other medical condition. You use a medicine, if you can't tolerate it, we're going to change medicines, right? But for those that are able to use these medications, if your insurance approves it, which is another conversation, they actually work on your fullness hormone. So you actually feel full and you eat smaller portions. And that is really awesome for patients that struggle with overeating, for patients that have a lot of challenges with becoming full, but they do need proper monitoring as well.
So we know how these drugs work. We know the side effect profile. We know when to pull people off of them. We know about the honeymoon approach to some patients also. However, there is behavioral modification or behavioral therapy that also needs to take place also, because gaining the weight back is will after you come off of these drugs if that modification from a behavioral standpoint of view and a eating and food choices standpoint of view has not taken place. Tell us about how important that is.
So important. So for proper treatment of obesity, we're going to have a comprehensive plan. So it's going to be based on your eating, your exercise. It's going to be based on medications.
You mean this isn't a substitute for diet and
No,
exercise?
absolutely not. And every day I have patients coming in saying, hey, are you going to give me that drug? And I'm like, whoa, let's talk about how we can help you keep your weight off. And we're going to need to adjust your eating, your movement, medication piece, as well as the behavioral part. So tracking your food, also weighing yourself, and then help for emotional eating.
Exactly. Some stress management.
Stress management and proper sleep all play a role. Now, these medications are actually for long-term use. So similar to blood pressure or cholesterol medicine. Now, just like those medicines, sometimes patients will lower their dose or they might come off of it depending on other factors. But if we don't explain to our patients that these are for long-term use, patients will stop them and gain the weight back. And if we don't explain to them that they have to change their eating, they have to change their exercising, and also get help for the behavioral part, the stress and the sleep, then we won't give them the success that they're looking for.
Childhood obesity is a real problem in this country. It's done nothing but remain out of control just every decade. We're seeing horrific numbers in terms of how many elementary and middle-aged school children, well into high school, are overweight. What is our approach to dealing with them? An injectable is not approved in that category. What are we doing to change this pattern that we see?
Good question. So really, when children are younger, like under the adolescent age, some children will grow out of their obesity, especially if their parents are given tools to help them with their eating and their exercise and their sleep, right? By the time we get to adolescent area, that's when a lot of people have challenges losing that weight and start to get those medical conditions that are related to obesity. So the great news is now there are more programs that really, for children, it's intensive behavioral therapy. So there's studies that have shown at least 26 visits to actually address obesity with children is needed because of the fact that it has to be a family approach. It cannot just be on the child, it has to be on the family with how they're eating and how they're moving. And other great news, there actually is the injectable medications have been approved for ages 13 and up. So now that's not going to be every patient, of course, but there's been multiple studies and they went through all the trials and phases to show that they can be safe in that population as well, especially girls, like after they've gotten their period, then they can be safe when they are part of a safe program, when they're monitoring these children and making sure we're adjusting their eating as well as their exercising and focusing on their health. Because adolescent children, that's an age where you already are growing into yourself and you might, trying to build up your self-esteem. So if we as their doctor are saying, you need to lose weight, that's unhealthy, instead of approaching it in a positive way, like, hey, we can help work with your family to improve your family's health.
Right. The family becomes very important because it's usually family meals, family activity. We saw statistics that says that if you got one obese parent, the odds of you being obese is going to be 50%, and if you have two obese parents, it's going to be 80%. The child will inherit the obesity.
Absolutely. And so part of that is because of what is eaten in the home and how that family moves. And the other part of that is that major genetic component. So our genetics and our family history does play a large role in our weight as well.
What can our community do about this? Are there outlets, are there resources, support mechanisms? What can the Black community expect in this arena?
That's such a great question. So there is so much being done actually for the Black community in terms of addressing obesity. So, Black churches can play a large role in this in terms of encouraging their the people that go to those churches to be active, to we're going to do Bible study and then we're going to walk afterwards, right? And hey, honestly, you can have a catfish dinner on Sunday, but it's also important to say, hey, now not on Sunday, we're going to make sure that we're going to encourage you all to eat your vegetables and serve kids also some foods that have more health quality to them. So that can be a huge factor. And then also just encouraging Blacks to be more active together. So we can gather together to worship. We can gather together to go to concerts. We can also gather together to move. And there are running groups that are in the Detroit area now that are encouraging this activity. There are community gardens that are going on that are encouraging fresh foods. And your food stamps card, those can also be used at local grocery stores to get even frozen and canned vegetables, which can also contribute to the health improvement as well.
Dr. Allen, we're always interested in what to expect in the future. The Star Wars approach to doing all this stuff is just an exciting time to practice medicine when we look at all of these developments. What's happening in the future in terms of obesity and weight management?
So obesity is now being recognized as a chronic disease, which is so exciting. And the more organizations that are starting to publicize this, the more patients are feeling they're able to take control of their health. And so down the pipeline, there's so many studies. There's actually like at least 3 trials going on right now for more treatments for obesity medicine, so which is very exciting. And so down the pipeline, it's just more education that we as providers are able to give our patients so that they can understand and have more ownership and able to be encouraged in helping to treat their weight.
Right. Well, you know, part of the problem is us. You know, we have conditioned the patients because we've been conditioned to think that every issue can respond to a pill or some type of treatment of that's prescribed by a doctor. However, long term, we should be talking about how patients achieve these goals on their own through choices that they make, diet, exercise, things that you mentioned, sleep. I mean, we can't overemphasize that enough.
You are so right, and that's why I actually chose the field of obesity medicine as well as family medicine. You know, I've always been passionate about prevention. And so you are so right. In medical school and residency, we learn how to care for our patients that become sick. We need more tools to help our patients stop becoming sick, right? How to prevent them from becoming sick. And part of that is giving patients, I keep saying tools and tools over and over again, because when patients have these tools of what they do, how they can eat, even with the busy lifestyle, how they can move in a way that's enjoyable for them, and how they can attain a lifestyle where they feel like their health is improved, patients are going to do better. We're going to see so many more better patient outcomes.
Very good. Dr. Allen, thank you for joining us today. It's been a pleasure.
Thank you so much for having me.
Our guest has been obesity medicine specialist, Dr. Dafina Allen of Wise Weight Management. Obesity affects nearly every part of the body. Losing just 5 to 10% of your current weight can reduce your risk of developing preventable chronic conditions. We all need to pay attention to the scale. Thank you for watching. For Primary Care, I'm Dr. Lonnie Joe.